Okay, so benzodiazepines, we will see about the benzodiazepine in the pharmacology. What is the benzodiazepine? Benzodiazepine we'll see the mechanism of action. So benzodiazepine are gamma amino butyric acid receptor agonist. Okay, it is the GABA receptor agonist which enhance the inhibitory synaptic transmission, enhance the inhibitory synaptic transmission through the central nervous system. Okay, it will increase the inhibitory synaptic transmission throughout the CNS system. Okay, with sedation, hypnotic, anxiolytic, anticonvulsant, and muscle relaxant property. With the sedative, hypnotic, anxiolytic, anticonvulsant, and the muscle relaxant property. So, when these benzodiazepines are used, so benzodiazepines are indicated for the short-term relief of the anxiety that is severe, disabling, and or causing patient unacceptable distress. Okay, occurring alone or in associated with insomnia or short-term psychosomatic, organic, or psychotic illness. The use of benzodiazepine to treat short-term or mild anxiety is inappropriate. Okay, benzodiazepine should be used to treat insomnia only when it is uh, severe, then disabling or causing the patient extreme distress. Okay, so benzodiazepines are the short-term relief used for the short-term relief of the anxiety. Okay, that is severe disabling, causing patient unacceptable distress, occurring alone, or is associated with the insomnia or short-term psychosomatic, organic, or psychotronic illness. The use of benzodiazepine to treat short-term mild anxiety is inappropriate. So benzodiazepine should be used to treat the insomnia only when it is severe, disabling, or causing the patient extreme distress. Okay, uh, prescribing of this drug is widespread, but dependence, both physical and the psychological, and tolerance may occur. Okay, this its use is very high, but its dependence, both physical dependence and the psychological dependence is there, and the tolerance may occur. Okay, therefore hypnotics and anxiolytic should be reserved for short courses to alleviate acute condition. Okay, so in the short-term anxiety, patient should give hypnotic or anxiolytic drugs. Okay, withdrawal of benzodiazepine should be gradual. Okay, its withdrawal also should be done gradually, because abrupt withdrawal may produce confusion, toxic psychosis, convulsion, or a condition resembling delirium tremor. Okay, because sudden stoppage of this or sudden withdrawal of this benzodiazepine may cause the confusion to the patient, toxic psychosis, convulsion, okay, or maybe delirium tremor. Okay, benzodiazepine possess useful properties for pre-medication, including relief of anxiety. Benzodiazepine possess useful properties. Okay, yeah, it also have useful properties for pre-medication, including relief of anxiety, sedation, and amnesia. Okay, short-acting benzodiazepines taken by mouth are the most common pre-medication. Okay, they are taken as the pre-medication for the relief of anxiety, sedation, to give the sedation and the amnesia. They are used most commonly by the mouth. Okay, and benzodiazepines are also used in intensive care unit ICU for sedation, particularly in those receiving assisted ventilation. Okay, in the assisted ventilation they are mainly used for the sedation. Okay, now we will see the contraindication of the benzodiazepine. So benzodiazepines are contraindicated in respiratory distress. Respiratory distress, benzodiazepine should not be given. Then marked neuromuscular respiratory weakness, marked neuromuscular respiratory weakness such as unstable myasthenia gravis. Okay, marked neuromuscular respiratory weakness. like myasthenia gravis, respiratory distress, then respiratory weakness like myasthenia gravis, then obstructive sleep apnea syndrome, okay, then severe hepatic impairment, okay, the elimination half-life of the diazepam may be prolonged, increased risk of coma, okay, because the hepatic impairment syndrome, the diazepam elimination may be prolonged and will cause the coma. Then phobic or obsessional state, okay, okay, phobic or in the obsessional state, like chronic psychosis or hyperkinesis, paradoxical reaction may occur, okay, in phobic state or chronic psychosis, paradoxical reaction may occur, okay, so it is not given in all these conditions like the respiratory depression, respiratory weakness like the myasthenia gravis, then the obstructive sleep apnea condition, then the severe hepatic impairment because it causes the increased half-life of the diazepam will cause the coma to the patient, okay, then phobic or chronic psychosis like condition because it caused the paradoxical reaction, okay, then cautions, which cautions should we take during giving the benzodiazepines. So benzodiazepines should be used with caution in uh, respiratory disease, okay, then the muscle weakness and myasthenia gravis, then the organic brain disease, then the severe renal impairment, okay, increased cerebral sensitivity to diazepam or reduced dose may be appropriate. Then dependent or obsessive compulsive or aviolent type personality disorder, okay, because it may be risk of dependency. Then frailty and the elderly, okay, increased falls risk, a reduced dose may be appropriate, okay, in elderly it may be cause fall, okay, of history of drug and or alcohol misuse or dependency, history of drug or alcohol misuse and dependency because it cause dependency. Then patients taking other central depression concomitantly, okay, like alcohol or barbiturate. So in these all these conditions barbiturate should be given occasionally. Then what are the side effects? So the adverse effect include drowsiness and lightheadedness, then the confusion and ataxia, especially in the elderly, amnesia, muscle weakness, okay, confusion and ataxia, especially in the elderly, okay, it causes amnesia and the muscle weakness. Then headache, vertigo, tremor, dysarthria, then hypotension, decreased libido, erectile dysfunction, gynecomastia, urinary retention, okay, this also the side effect like headache, vertigo, tremor, then the dysarthria, hypotension, decreased libido, erectile dysfunction, gynecomastia, and the urinary retention. Okay, decreased libido, erectile dysfunction, gynecomastia, and the urinary retention. Then paradoxical effects such as talkativeness, uh, excitement. Okay, paradoxical effect like talkativeness, then excitement, then irritability, uh, uh, aggression, then the antisocial behavior and suicidal ideation, okay, then withdrawal symptoms, for example anxiety, depression, anorexia, impaired concentration, insomnia, abdominal cramps, palpitation, tremor, tinnitus, and the perceptual disturbance.